ATEH Redela, Epse AWUNGAFAC. I be former nursing student from the Faculty of Health Sciences, University of Buea. I'm a nurse by profession, and today I go to talk for now about cervical cancer. Now sick where the worry only woman them. Man picking they no get cervix, so cervical cancer no fit worry man picking them. So where to be cervical cancer or where to be cancer? I might first talk about cancer as a whole. Where to be cancer? Cancer now abnormal growth, rapid or abnormal growth of cells and for your skin. That means say your cells and for your skin they just grow anyhow. They just grow like crazy people. Anyhow they just grow away. Maybe your DNA never give them all that say me they act so, because DNA is the thing where they give information for your cells and say, okay, I think this way you get to do now, I think this way you get to do now. Alright. So cervical cancer now a malignant tumor where it grow for your cervix. Now, wait till they cause this tumor, wait till they cause this abnormal growth for your cervix. First of all, cervix be found inside the human vagina. I know say plenty of we women they will not even know plenty about our anatomy. And the cervix it be found inside your vagina. Now, it is like a gateway between your vagina and your uterus, or the thing we would call and say womb. Now the gateway where it is between these two organs and for your skin. So when you get cervical cancer, it means say that organ the door for your uterus it don't grow abnormally. Yes, nothing that way it means. Alright, so the cause is now for cervical cancer. Wait till they cause this cervical cancer. The main cause now some virus where they call and say HPV, human papilloma virus. This human papilloma virus it be present both in male and in female. Man can catch the virus as well as woman can catch the virus. But now it affect only woman for give cervical cancer, and not be all women the way they contract the human papilloma virus that they get cervical cancer. So when you don't contract this human papilloma virus, it now cause mutations then for your DNA. As I be first explained for una, DNA na the thing where they give instructions there for your cell on how to behave, how to replicate, how to multiply. So when it causes now these mutations then for your DNA, the cells then just decrease, they just do anyhow, they just multiply anyhow, they know they die as fast, because normally cells then for your skin they multiply, then the old ones then they die, so that the new ones then fit take their place. But for when your cell be cancerous, they just grow and grow and grow and grow. Then you see as maybe the place they become, you get tumor, maybe the place become larger and all of that. But for cervical cancer, it's not totally the case. Okay. Now we'll talk about the signs and symptoms of cervical cancer. Cervical cancer, when you get cervical cancer, you bleed through your vagina, you get painful sexual intercourse or pain after sexual intercourse. And then when you don't get the cervical cancer, when you don't be contracted, when you don't contract the human papilloma virus, when you don't get cancer, you get different sets of signs and symptoms where you get maybe painful urination, urination with blood, you get swollen legs, you get nausea. That means you tired, you get fatigue. That means you just tired, you know the feet, and then you get loss of appetite, so and then you grow pale. Normally when they can't sick there for your skin, you hardly feel grow fat. Only the trauma where they give for your head, it just make them automatically you grow pale. Okay, now we I go talk next about the risk factors them for this cervical cancer. What if you make them maybe exposed for get this cervical cancer? Number one, if you get plenty sexual partners them, that means you there for this side, 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 you there with John, you there with James, you there with Uncle, you there with Daddy, and all of them. So now one of the main causes in that, because as I talk, cervical cancer, the HPV, they be present for man picking if he catch HPV, but it not go cause them anything, so they don't feel like so they even get any sick. But you, when you go get sexual intercourse with that man picking where you get HPV, you the get them, and that HPV they come for you can give you cervical cancer. Now one thing that way we get to be very careful. Another thing that saying when you get early onset of sexual experiences, that means if you start very early, yeah, so now another one of the risk factors in that. Then other STIs them, if you get other STIs them like chlamydia, syphilis, it be prone, it give you like it make it be prone for get HPV, because first of all your immune system it be weakened, giving way for other opportunistic infections there for catch you. Another thing that if you be on contraception and if your parents they be take drugs them for prevent miscarriage, this particular condition, if your mommy be take medicine where it go prevent it for get miscarriage, that means for say may no loss you le pikin, you get some counter effects for your, not everybody, but it's just a risk factor. When you be exposed for the medicine the way it prevent miscarriage, you get something where they call and say clear cell adenocarcinoma. Now some kind of cervical cancer where they catch you, where not be say you don't get in contact with HPV, the virus where they cause cervical cancer, but now say maybe your mommy be take some medicine where it don't can affect you now for your later life. Another risk factor na smoking, where it is smoke, it make a be prone to get all these diseases them. And then if you get weakened immune system, because if you get other sick the way they weaken your immune system, where they make now other diseases them feel easily catch you. So now we go talk about the prevention, as I ever talk, the easy way for just remember say I wait I get to do for prevention. If you know the risk factors, then you go know thing for stop them. Like I talk, prevention, you get to limit your number of sex partners, you get to stop smoking, you get to live healthy, eat healthy, live a healthy lifestyle. And the most important prevention now for you for take your vaccine. Some vaccine day where they give for people then for prevent cervical cancer. I think will be very important. I say may go to do your test for hospital for check if you get cervical cancer, and the name for this test na pap smear. So apart from that, now if you say the treatment them for this cervical cancer now, it not get plenty thing for do and it not really be curable. But the only thing for manage their symptoms them for this cervical cancer, you get surgery and radiation therapy, chemotherapy and biotherapy, just in there for manage your symptoms them. But actually for now HPV, when you get infected with HPV you not really get any cure. Thank you my dear listeners them. I thank you very much for having me on this show. And the most important thing the way I want to say as I go make una get for una head, very important. Ladies, always do your test, do your pap smear at least every year to know how far, to know what's happening. Because that organ where they say your skin, you know if you know to where it happen. Take your vaccine, very, very important. Alright, that is all I have for you people today. And most especially I want to thank my host, Mr. Hisham. Thank you very much for this opportunity. But you don't give we make we fit talk for people then so and then get the word across, because it's very important. Knowledge is not to be kept, but it's to be shared for everybody to benefit. So thank you plenty for this opportunity. I would like to come back again for meet up una and share another amazing thing where I get them in store for una. Thank you very much. Don't forget to like, to subscribe to this YouTube channel so that you learn many more amazing things. Thank you.